My name is Sarah Griffin. I am a professor in public health sciences here at Clemson University, and my area of expertise is in healthy lifestyles, particularly related to chronic disease prevention and chronic disease management, mostly focused on childhood obesity. So this time of year, while students are getting ready to go back to schools and schools are getting ready to welcome students, there's several things that they can do to help ensure that schools are creating a healthy environment, a welcoming environment. And it's all about creating that culture of health and everything that you can do to promote those healthy nudges in a couple of areas. When students are going back to school, that's a big time for transition for families, and in particularly for the students that are going back to school. And so it can be difficult sometimes to go through that transition. So there's several things to pay attention to and to continually monitor with your child and with the children in the school. So you want to look out to see, are they showing any signs, early signs of getting sick? And if they are showing signs of becoming sick, getting that checked quickly. So if they're starting to sneeze more, cough more, be a bit tired, it's important to recognize those signs early, get them seen, and determine if they have caught something when they are around all of the other students at school. It's also a time when sleep habits are changing, so they may be getting tired, so it's important to adjust that sleep before the school year starts and to ensure that students are getting enough sleep. And then also, if students have spent more time either alone or with a smaller number of folks in the summer, it may be sometimes a little overwhelming for them to go back into the school environment and be around hundreds of other students at the same time. So it's really important to talk to your child every day using open-ended questions that ask them about their day in a way that that gets them to talk. So not just a, how was your day? You'll get a, it was good, it was bad kind of answer, but what was the most fun thing you did today at school? What was the easiest thing you learned? What were some of the hardest things you tackled today at school? Those conversations help you stay on top of, are there changes in my child that I need to be aware of? So we are seeing an increase in childhood obesity slowly over time, and in adult obesity in the U.S. Population. And there's several things that contribute to that. And excessive screen time is one of those things, but also diet and so what folks are eating. So nutritional value and playtime are all really important. Since experiencing COVID-19, the conversations within school systems and families around improving health, maintaining good health, has changed in just a few ways. I think we're still talking about a lot of the same topic areas. We're still talking about sneezing into your elbow, not your hand. We're still talking about washing your hands. We're still talking about giving people personal space. We're still talking about early identification when people are not feeling well and getting into care quickly or as soon as possible. I think since COVID, there's just a heightened awareness of that and a heightened sense of paying attention to both those good habits and that early identification and getting into care really quickly. And then if a person is sick, staying home. Super important to reduce the spread of anything from cold to flu to COVID to whatever.